you know that.
Currently out of work with twins and a kid in kindergarten. Very proud of you for putting me out of work.
I'm sorry.
Very proud of you. Because my own personal choice, because I don't want nosebleeds all the time, and I don't want to have this thing rammed up my nose. I'm a perfectly healthy person. I don't leave my house. I don't leave the goddamn island, even when I'm allowed to. Like, why am I being disciplined for being a healthy person taking care of elderly? I was good enough all this pandemic. All this pandemic, I was good enough. Great enough. One of the best on the floor, in my opinion, because I have that kind of personality where that's where my heart is. You took my heart away from me when you took that job from me.
Well, I'm sorry.
I missed 2 shifts without pay. I have kids to feed. What are you going to do for me?
Well, I guess we'll have to try to find you another place to work.
Another place to work.
Well, I mean,
I got my education,
wants
Dennis.
to
I
do it.
stood and fought Stephen Harper to never land on EI again.
Yes.
Then you guys got empowered ever since. And I've had the same career since I made that oath that I'd never end up on EI again, and I never
I
did.
certainly hope you don't think I brought all of this here. This has not been a picnic for anybody, including myself.
Where's the proof that
I'm not sure what I
where's the
signed up
proof that
for.
the swabs even work?
Let him speak.
Or that they give positives that are correct all the time, or that, you know, that even the negatives are correct.
Well, I think from what I understand, based on everything that I have learned through public health, etc., is that the testing swab will to 100% pick up a negative, and then if you do a tentative test, they take you up to do the test.
So the Health Minister of Ontario, the Deputy Chief, which is Heather Morrison, said the teachers back in the fall of 2020 didn't need to get tested because they were always getting false results. I can show you the video.
I'm not saying you're not.
So why would one health professional say something like that?
I don't know.
Unless the teachers were. What, Dr. Yaffe? Dr. Yaffe.
If we come in with names and stuff from doctors who have...
I understand where
So, and he openly admitted that he agrees that I lost my job because he just told me that he's going to find me a job.
exemption, which is now...
Like I'm not quitting, and they won't fire me.
Yeah, what'd she do? She
What do I do?
She can't draw an appointment because she's
You should have thought of all this before you put all this into play.
Tough situation, and we need people like you in there. Absolutely.
Like, I am not out there to hurt people. I am not out there to go spread germs.
I don't think
I
anyone
do my
spreads it
proper
purposely,
care
yeah.
while you guys are treating people like they are.
We're just trying to make sure we can do the best we can.
I think everybody does a great job on PEI already.
We have been doing a pretty good job.
Like, we haven't heard of influenza A or B since this all started. Where did that go? Where did it go? Oh, gone.
Congregating the way we used to over there.
These masks you're forcing on the little kids in school, if it's such a deadly disease, we don't live in the Spanish flu era with cloth masks.
No,
We
no.
live in the era of N95 masks. So why is not every professional that's putting their lives at risk of this deadly disease not wearing an N95 mask? I definitely wasn't wearing one around the elderly. Wow. But it's a deadly disease that could wipe them out, right?
Well, it
Deadly
seems to be,
disease
yeah.
that could
I mean,
wipe
it's
them out, right?
killed
Who says it's
millions of
deadly,
people so
Dennis?
far across the world. and
How many people
500,000 or more in Canada have died. And
How many
that's-
daughters closed in
I don't know.
2018?
Same
You can't answer us because
Same amount.
I don't know.
Well,
No,
you
there's
better
been no
hope
flu
not.
death
don't know,
this
do
year.
you?
I know that.
How many people died of COVID?
This year in Canada,
Yeah,
593,000 or something like that.
25,000.
No, 593,000.
No.
Check
26,000.
theirs.
It's
Check
going up to
theirs.
27,000 now.
Check theirs.
I don't know.
Yeah.
Bears is the American one, isn't it? You don't even know what Bears is and you run
Do you know why
up.
they
I'm glad you guys are
made the
reporting
Bears?
this.
Yeah. What is
I'm
it?
glad you
Bear? I
guys
never heard
The
of it.
Bears.
The Bears, no. I don't-
Never heard of it.
Actually,
I hope
Adverse-
these videos go
Exactly.
viral,
Yeah.
guys.
Oh, they're gonna.
Nuts.
Yeah, I mean, we deal with public, health, and I'm dealing with it every day. And
So do they.
the best advice I can. And I'm not a doctor.
Doesn't
You
matter
know,
if
I'm
it's American or not.
a young guy who grew up in Georgetown, trying to do the best I can here, and have to take my advice from the people who.
But you don't. No, you
I
don't.
take the best advice. I've taken the same advice consistently from the beginning, and that's why we've done so well.
Are you going to give advice next election, Dennis? Who are you going to give advice to,
Well,
Dennis?
listen, I don't worry about
You're gonna have
if you
to get
don't
out
vote
of
for me.
town.
I can't. That's fine. I mean, I'm not here to try
Elections
to
are rigged.
vote.
We all already voted anyway. Elections are rigged.
Brown nose are liberal. That's what you are.
Listen, if I can get through this and no Islanders
You
die or no
can't
Islanders
get
really
through
sick,
this without us,
then it's,
Dennis.
Like
that's
this,
right.
you guys
Whether or not I get
opened
reelected
school
or not,
this year. You guys opened school this year, and you shut it down over less cases last year. Yous are contradicting yourselves with your movements. You're
we have
flip-flopping back and forth like fish out of
almost
water. Make up your mind on what you
of
want
two
to
vaccines are ready together, so that should give us.
What's in the vaccine?
do.
Can
And
you
why
explain
should
it?
our children get it when there's a 99.5% survival rate for them?
Well,
When they
12 and under
naturally
don't.
can build their immune system naturally.
12 and under don't.
Naturally.
Hold on a
The
second.
natural way.
If you were to jump out of a plane and they told you that you had a 99% chance of surviving, would you even put a parachute on? Why would you?
Why would you?
Why
Because
would
you're
you?
being told to.
I think
If
you know
I'm-
if I jumped out of a plane without a parachute.
Okay,
I
but
wouldn't
listen.
survive.
Does this make any common sense to you? Every time I've ever been sick in my entire life, I knew that I was sick. I didn't need to go take a test to find out if I got a sickness. So
we
how
need
does
to
that make
stay
any
home.
sense?
Well, I guess
It doesn't. It absolutely doesn't. I'm
You
sorry.
happen to spread that to
No.
someone who's vulnerable and they
No,
get sick.
no. A 99% survival rate.
Spread
You can't
nothing.
kill somebody that's going to survive it.
Spread propaganda.
Vaccinated or travel? Tell me that.
And how come at my place of work,
Yeah.
you guys said that the vaccinated can still contract it?
Yeah,
And spread
93%
it.
of the cases.
How come they're not getting a swab up their nose every shift or 3 times a week? When they can go traveling,
What about
come
Agenda
back,
30?
They can do whatever they want.
What
and
about
bring it
Agenda
into
30?
that
You don't know what
facility.
that
But
is?
You're narrowing in on the unvaxxed.
Well, if you don't know, why are you leading all this province?
Well, I don't know
You're-
what
you're-
Agenda 30 is.
But you should know. You should know. Yes, you do, and I know you do. You're lying.
I don't know.
You're absolutely lying.
I do have a
100%.
question. I have a
We can
question,
disagree
Dennis.
with
I
you.
have a question. If you okay,
She's got a question.
if you
Yes, you
want,
would.
if you
Yes, you
want
would.
every single,
I'm
if
sorry.
you want,
You've lied to the public.
Like
all
I
the
can't
time.
believe,
Last 18
I
months.
can't believe that you're discriminating your healthcare
Okay.
workers as unvaxxed and vaxxed. Get your swab unvaxxed, but you vaccinated ones that are allowed to travel can go to work the next day
And we
from
can't
getting
travel.
back
That makes
and
sense.
go to work at a long-term care facility and not get swabbed.
You can still get it. You can
So
still-
where is
you
your
can still
logic
get it.
on why I'm out of a job right
We want
now?
answers. That's all
Why?
we want is answers.
Why?
honest
These are
answers.
professional questions to you.
I
Professional
voted
questions.
for you, and
that
I want
makes
answers.
sense.
I called.
And I'm glad it's on camera
I
that
also
you don't know
have
the
the answers
answers.
that you want.
I
But that
called
doesn't mean
your
I'm not giving you
office
answers.
twice in the
if you
last.
don't have answers,
Four
then you're
I've
months.
called
pushing
your
us on the
office
people.
myself as
That's
well.
right.
I'm giving you answers.
And
You're
yeah,
not the
they're
ones
not-
you want.
No,
No,
so they're
you
not.
You
should know
don't
more
have
about
any.
this vaccine that
You
you're
didn't
pushing.
even know.
Well,
that.
No,
You don't know
Trust
anything about
no.
The professionals who
He's
do
not
this.
the first.
it. Yeah, but you don't even know what's in the vaccine and you're pushing it on people.
I don't know what's agenda. I don't know what you said asking about Agenda 30. I don't know
Yes.
what that means.
What about
Then you should
SO2?
research
What's
that, because
that? Do you know what that is?
What is it?
SO2, do you know what that is? What about graphite? Do you know what that is?
It's an element. Yeah, is that what you mean?
Graphene.
It's in the, no, graphene?
Graphene.
Graphene.
Okay, it's in the vaccine and you don't even know.
And it's on
And you're pushing it
swabs.
on people.
And it's on swabs.
Yeah, ask that question, Angie. There you go.
I want to know why.
Okay, guys, give her a chance to ask the question, please. Yeah.
First time. I appreciate that. I
Yeah,
truly
one
do.
at a
And we do.
time.
Thank
Sorry,
you.
we just.
We all
Okay,
appreciate
you know what?
this.
And it's, you know what? A healthy debate is a good debate.
This is
Okay,
another
what I
thing.
want to know is what is in the vaccine that's going to save everybody from this pandemic? One, and if you don't know, why are you insisting that everyone on this island is vaccinated?
Well, as I've been saying, I am not a medical professional.
No, but
And I'm
you.
not pretending to be.
No,
Not once have I ever pretended to be.
no, we know that.
When I get expert advice on education, I talk to the people who are educational
We need to
experts.
talk to Heather Martin.
Okay.
When I talk to, get my advice from a medical perspective, I talk to the professionals, and that's what I've done from the very
Okay,
beginning.
okay, so this is what I'm gonna say
we
right
don't
now.
let our get
I'm gonna come back here tomorrow, and you can go back and ask your professional medical team what is in the vaccine, and I will wait here for an answer.
A list of it.
We'll wait with
You
you.
want a list?
And I would like to know why pharmacists that are shoving this into people's arms cannot give an ingredient list to them, people sitting before them, before they get a shot into their arm. While I could phone them and they could tell me to phone Heather Morrison for the ingredients.
But she will not
But
answer
they
us.
will inject it into their arm. That's their duty. They should be educated on what they're injecting into people before
Not
they
coerced.
inject it.
Right.
So every pharmacist
sure there
is
are
breaking the
oncology
law
nurses who
as
give you
of
chemotherapy
back
that
when
probably
they
can't name
started.
everything that's in the chemotherapy.
This is different. This is different.
This is an agenda.
This is different.
Certain amount of
Chemotherapy, people are already dying.
This is
certain
We're not
amount of
already
trust you need to
dying.
put in the professionals who do this
I have-
every day, and whether or not you agree with that, that's your right and your right to be here to share your expression of opposition to that. But from where I stand, I'm trying to do the best I can for the majority of people to keep them safe, and we've done that, and I'm glad we have.
You
And,
think you've done that?
well,
Yeah.
so far
There's
It's
we've
been a long 18 months, we all agree.
They're not dying of
Yes,
I don't
but
think
this is just
radical, insane, or
Thank you, 'cause
anything.
no, but it's really just talking head stuff.
Absolutely having an opportunity to express your
Dennis, I
views.
got a couple of questions, and I think you know me.
I think I do.
Yeah. First question, the PCR test. It was deemed from the CDC that it was null and void to determine and distinguish between SARS-2 COVID-19 and the influenza flu. It was terminated back in June. Why is it still being used today?
I can't answer that.
Can we find out?
I can certainly ask Dr. Morrison and my professionals if I'm sure, absolutely.
Would you meet with us someday so we can answer everybody's questions?
Saturday at the rally.
No, would you-
Please.
Well, I don't know if that's
Is there any chance-
really
No,
good
that's
spot
a
for me
great
to
spot.
get
That's a
It's supposed to rain, so there's no golfing, so you're all right.
That's a great spot.
certainly try, sure.
You can
yeah.
sit with this group here and take their questions.
I'll do my, sure, I'll try my best.
We'd love
Yeah.
to have you.
I'm not
It's
sure I
all
have the
being
answers you
recorded,
want me to
so-
have.
No, but we would appreciate you trying.
Sure, I'll try my best like I have here
That would be
to.
good.
Yeah, you've heard our voice and a few questions. It'd be really great to get a response as soon as possible. The way that the things are running right now, is considering the election and everything else, people are busy. We would appreciate the answers soon enough.
Until I'm out of the job, I'm
Truly appreciate you coming out.
and I'm trying to do it.
And I have
Yes.
one more question.
Oh,
if I
you're
can.
also asked to go on a podcast as well.
Yeah, okay, so what I want to know is, every case is on TV and gets blown up, out of course and stuff. Anyway, but the injuries and the deaths are never reported, and I want to know why. Because there are many islanders dying, and there's many islanders getting injured, and I hear of it all the time, and I want to know why it's never reported.
Car accidents.
No, I mean from
Come
the
now.
vaccine injuries.
Vaccine.
Come on.
Vaccine-related injuries and deaths, I
They're all
know,
over
because it's
the place.
covered up.
Associated.
We all know it, and that's why we're here.
Well, I don't know anything about that.
Okay,
but-
then you should
Well,
find
it's
out
being
as the
reported
premier
by
of
the
province.
frontline people as well.
If you guys are pushing this on every single islander, then you should know that there's vaccine deaths and injuries.
I'm tired of I'm tired of asking the public what's going on. Did you get the shot? What happened to you afterwards? I'm trying to find out by word of mouth because that's what we're taught to do
Well, I
this
got
day and
double
age.
vaccinated.
That's
You're lucky
great.
that you're-
Well, it seems to be the, sorry.
Oh.
Sorry. But look, I appreciate you being here. I'm sorry I don't have all the answers you want me to have.
That's okay. You can meet us on Saturday.
Yeah, you can meet us on Saturday, and you can also bring Heather Morrison because we want answers.
Yes, if you want to speak, we'd love to be able to speak with Heather Morrison as well.
May not have all the answers, but if you hear them out, I think that's
Well, I appreciate it. I appreciate you being here. Thank you. Thank you.
And I do appreciate you coming down like that.
Yes,
We've been
yes,
wanting you.
very much so.
And this is all we want. We want somebody to come
That's
talk.
all we wanted the whole time.
Yeah. So we want to open that dialogue. We want to open that dialogue a little bit more now.
question and answer form. That would be fantastic.
And for the record, we were at the hospital today and on the 1st, not against healthcare workers at all. So the media is putting that.
In total support of our healthcare workers.
Exactly.
But you
We
do that
are.
here.
Aren't we? In total support of our healthcare workers?
Because the Canadian
I know, but it's
Canadian
still-
frontline nurses, all
It's not like we're crowding the emergency room. We're on the sidewalk.
same thing.
Do it here. This is a better place for you.
Your next problem's going to
Controlling
come
where
when
we
the third shot
protest.
does land here this month, because it is
Well-
probably landing here this month.
Yeah,
And
there
the police
probably will be
side-
a
and the
third shot
When
for
you
America.
realize how many people are going to refuse their third shot,
Yeah.
Yeah, but
what are you going to do? Put them out of work too? Are you going to put them out of work too?
I'm losing employment because.
well, when the workplace enforces
Yes.
employees to
Or
get
you're
it, that's
gonna lose your
war.
job. That's
Yeah.
No,
It should be their choice.
Yeah, and the government has no money.
Exactly.
You can do vaccine or submit to testing, and that's. the
No, but
story.
those are are both
That's
against
wrong.
internal rights and freedom. They are.
Everybody should be tested.
Your healthcare system is already run short. You know your nurses are run hard. You know your LPNs are worked off their
You cannot
feet.
override.
You know your healthcare system is changing. It's a matter of time.
Other jurisdictions.
You believe that
I don't want to do that. I would wish to
What's
know.
your plan when you're so
Nothing
short of
more than I
workers
would
that
like
your
to never
healthcare
say the
system
word COVID
crashes?
ever again in my life.
Well,
I
all we gotta
promise
do
you.
is stop it.
I
Because
promise
it
you.
doesn't exist. It doesn't
There's
exist.
no death.
If I
does
could
not
stop
exist.
it, I would
No
stop
death.
it. If I could
does not
stop it, I
exist.
would stop it. I'm a small cog in a very big
So are we, but
Yeah, but look at the connection we made right now. Yes.
We can see it.
Yes.
Speak up then.
I think he's on time, guys.
we need all of you.
I'm immune
Yeah.
suppressed.
thrust into a job, and I'm just trying to do the best job I can do to do
I'm
it.
immune suppressed, right?
What is it?
I'm immune
Oh, sorry,
suppressed. So
okay.
you're trying to protect me, right?
I am, absolutely.
So
Yeah.
why am I getting denied
Well, if
job?
you're immune suppressed, then you have a reason not to have the vaccine. And you
Is that true? Hey,
Then why am I still getting denied checks?
No.
I don't know.
Can't go anywhere.
I had my exemption removed.
who works with
Yeah, have it removed.
Get an exemption.
our whole
You should look into
facility
that.
has quite a few. Like,
Yeah.
What's your stand on the vaccine task force for the province?
I think that's where we're going, I believe. Yeah, I think that's where we're going.
Guess what? We're not having it.
Well, you'll be able to do anything. You'll just have to be tested if you don't have the vaccines.
So I have to get tested just because I'm immune suppressed.
Well, absolutely.
These tests are actually
What
criminal.
does that mean?
Yes.
They're criminal.
But the test is just as dangerous for the immunocompromised.
Yeah, but you're still able to spread the virus.
No, there's
So
no.
is the vaccinated. The vaccinated
double shot and still
Dennis.
spread it, Dennis.
The vaccinated
Anyway,
can
listen,
still
You
get
openly
saved
said
by.
that the double vaxxers spread.
We can talk more. We can talk more in the future. We very much appreciate it.
Thank you so much for coming out.
See you Saturday and bring Heather. We want answers. Thanks,
Thank
Dennis.
you. That's all we needed, Premier. Thank you. I'm shaking.
You guys happy? You guys were happy with that? You guys feel okay? Wow. You had to drag him out by his teeth, Angie.
Queen bee has a hornet's nest.
That's good. It's good. It was good that he did that.
Yes, it was perfect.
Another job. I don't want another job. I don't want my.
If you don't want the vaccine, then you've got to be tested. No testing.
Well, that's what I said. I don't want to test.
Thanks for asking those hard questions.
I hope it goes
Yes,
viral.
I hope it goes viral. I hope people see this and realize
Realize
what's going
what
on.
ignorance we
I was a
have.
little bit
How ignorant is
brash,
that?
if you want to call it, or brash.
Ignorance.
But
Ignorance means
You know what I mean?
lack of
I'm just
knowledge.
like Angie. I can't let loose. When it comes to me, I gotta say it.
Yeah, no, but I mean, I was very